Medicare can feel overwhelming. You want a plan that fits your lifestyle and budget. But there's so much to learn. Where do you start? First, find a partner you trust to make your Medicare transition as smooth as can be. Maybe that's someone like me, an insurance rep. I can help you get started. So, you're probably wondering what you need to know about Medicare. Let's start with some Medicare 101, like the parts of Medicare and types of Medicare plans. The most basic Medicare coverage is called Original Medicare, which is made up of Parts A and B. Part A, or hospital insurance, covers care you get in a hospital, skilled nursing facility, nursing home, hospice, or from home health services. Part B is your medical insurance. It covers things like doctor visits, outpatient services, and some preventive care. There are certain times when you can sign up for Original Medicare, known as enrollment periods. Here are the most common. When you turn 65. This is called the initial enrollment period. It starts 3 months before you turn 65 and ends 3 months after, giving you 7 whole months to enroll in Medicare. When you're no longer covered by your employer's or spouse's plan. This is called a special enrollment period. It's for special life events like retiring or moving to a new state. Part D, prescription drug coverage. You've got Parts A and B down. Now, on to Part D. We'll get to C later. Part D is prescription drug coverage. Once you sign up for Parts A and B, you can buy a Part D plan from a private insurance company. If you take prescription meds, make sure you find a Part D plan that gives you the coverage you need. Okay, now that you know the different parts of Medicare and how they work, you can decide how you want to get your Medicare coverage. You have 3 paths to choose from. You can choose Original Medicare only, choose Original Medicare and pair it with a standalone Part D prescription drug plan and/or supplement plan, or you can do what most people do. Buy a private Medicare plan like a Cost or Medicare Advantage plan. Some may include Part D, while others you can pair with a Part D plan. All 3 paths lead to some level of health coverage, but one may be a better fit for you than the rest. Let's spend a little time talking about that third path, buying a private plan. Now, you may be wondering, if I get Medicare from the government, why should I buy a private health plan? Most private plans offer benefits Original Medicare doesn't, like these. They also help lower your out-of-pocket costs, even when you travel. This happens in 2 ways. First, unlike Original Medicare, most private plans have an out-of-pocket maximum. Once you pay that amount, the rest of your costs for covered services are covered for the rest of the year. And second, private plans help replace most of the Original Medicare co-insurance costs with copays, which are often less expensive. With Original Medicare, you'd pay 20% of your bill, but with a private plan, you could pay a fixed dollar amount for the same service. Here's an example. A covered specialist visit that costs $1,000 would leave you with a co-insurance cost of $200 under Part B alone. With a private health plan, you may be able to replace that amount with a smaller copay, like $40. Questions to ask as you shop. Now, these are just a few of the reasons why a private plan may be a good choice. If that's the path you decide to take, be sure to ask these questions as you compare Medicare plans.
Can I keep my doctor?
Ask your current doctors if they accept Medicare, and then check the plan's network to see if their names are listed.
Do I need referrals to see specialists?
If you see specialists like a chiropractor, make sure you understand how your plan works with them.
Am I covered when I travel?
If you like to travel, this one is a biggie. Take a look at the plan's travel benefit to make sure it fits your lifestyle.
Does it have a high star rating?
This is a yearly quality rating from the government. Think of it as a way to know which plans are doing a bang-up job.
Are my meds covered?
Make sure by checking the plan's formulary.
Is there a dental or fitness benefit included?
Another perk of a private plan is that it may also help cover the costs of seeing your dentist or going to the gym. So, what are your next steps? First, You'll need to enroll in Medicare Parts A and B when you're eligible. Then, choose the path that's right for you. And if you have questions along the way, reach out to a Medicare expert you trust. Whether it's a family member, friend, broker, or someone like me, an insurance rep. A reliable resource will help make this transition a piece of cake.